I'm Scott Patch, and I want to thank Steve for including me and the rest of the Top Gun advisors for including me in their program. I also want to thank all of you for sticking around to the end to listen to my presentation. I think Steve said maybe it's been different, but I'm actually the only entrepreneur who's not full-time in my entrepreneurial position at this point. I am still a full-time practicing physician at InterMed, which is Maine's largest private primary care group. I practice up in Yarmouth, and I am also InterMed's electronic health record implementation specialist. I do all the workflows, the designs, and help roll out our electronic health record. I have formed a company called Protocol RX based on my experience with that, and I am looking to Top Gun to help me move this product along. All you have to do is look at your health insurance premium to know that doctors don't make the best businessmen. And so I hopefully will be learning a lot of business skills from the Top Gun mentors to manage a cost-effective and efficient business. Next slide. Protocol RX is a product that I started thinking about a little less than a year ago. It came from a project that I'm doing at InterMed, where if any of you are our patients, you've had this experience. We decided when we were moving into our new building in Portland that we wanted to build a call center. The purpose of the call center was to capture a lot of efficiencies in terms of staff and in terms of schedules and other things, and also to improve our customer service. All the surveys in the industry show that the most frustrating experience you can do is actually call your doctor to make an appointment, refill. Our approval ratings on the phone side of our business is very poor. Generally, it's the #1 reason that patients leave practices, not because they don't like their doctor. They can't get through. There's poor communication. There's poor phone customer service. We opened our call center about 9 months ago, and two things became immediately clear. One, we grossly underestimated the number of phone calls we would receive. And the second was that our fancy new electronic health record system really doesn't work very well in a call center environment. It's a cumbersome device to use. There's a lot of screen jumping. If you call in, you may get the feeling that our nurse is fumbling around a lot trying to find information to help you on the phone. Our goal was, and we're working very hard to achieve that, is 80% of the time you call in, that person on the phone will be able to answer your question without putting you on hold, without putting you into voicemail, without having to call you back on another day. The problem with that is our EHR really slows us down. So instead of what's taking a very short amount of time, is taking a longer time, and therefore, if some of you have called, you've heard you are 13th or 14th in line. We want to get rid of that by improving our efficiency. Protocol RX is designed to do that. It is a decision support system for the electronic health record, so that when that clinical assistant pulls up your chart with the telephone encounter, they're going to have the pertinent information that they need to help you at that moment. I centered Protocol RX around medication refills. The reason I did that was because medication refills are very amenable to decision support. There's very defined rules that you have to do. And the fact of the matter is, medication refills are our #1 business. We handle literally 1,000 phone calls a day. We receive anywhere from 100 to 140,000 refill requests per year, and that's just in a 25-physician practice. InterMed is 60 physicians. 50 to 70% of our phone calls are simply, I need my Lipitor refilled, can you help me? We estimate that it takes us about 4,000 to 7,000 hours of labor time to manage refills. So with that, if we can improve our efficiency by just a moderate percentage, we will improve reduce our costs. Decision support in the electronic health record industry is a fledgling component. Part of the other reason I picked medications as a product or medications to focus on for my product is that all of the competitors in my market, which are essentially the big electronic health records, GE, Epic, all of those people, their decision support is primarily focused around having that patient in the office and doing their chronic disease management. No one, as far as I can tell, has been focusing on the telephone side of our business, which it represents about 50 or more than 50% of our patient contacts. I'm more likely to talk to you on the phone, not me, because I never talk to patients because I'm a doctor. No, I'm just kidding. But my office is more likely to, is equally likely, if not more likely, to talk to you on the phone than it is to actually see you in the office on any given day. So, been working on Protocol RX. I thought I was the youngest company in Top Gun. I've lost that by a month. We're about 4 months old. So we're developing this product. It works with other electronic health records, so that's part of what I need help with Top Gun is how do I approach GE? How do I approach these other companies and say, build my product into your product to make us more efficient? Next slide. These are just the advantages that we hope to include with this product, not only making it more efficient for my end of the business so I can bring home more money as a physician at the end of the day, but also to reduce your costs as consumers. If we can charge less, if we can be more efficient, we can move patients through. Therefore, we have less incentive to have these higher charges that get knocked down 80% by Medicare. We will improve your satisfaction as a patient. Wouldn't it be nice to just pick up the phone and say, I need a refill of my medication, and have the clinical assistant say, yes, I can do that. It's at the pharmacy now, and here's a couple of other things that we've found out that you need in a matter of minutes, as opposed to waiting an entire day to see if you actually get that refill or not. Obviously, improving quality of care. We hope to reduce liability. Medication errors are a big source of liability. If we can reduce that through protocol systems, then that helps us on our end. And then we increase our revenue by catching those patients who I'm refilling their medication year after year, but I haven't seen them because they're skirting under the radar there with their medication refill requests. They're calling on Saturday. Can I have a refill of my medication? The doctor says, yes, go ahead. In terms of our market, as many of you know, or all you have to do is read the paper these days, electronic health record information systems are big news in terms of federal money for healthcare. You need decision support in order to qualify for what they call meaningful use, in order to get reimbursed by the government for purchasing your electronic health record. Decision support is part of that meaningful use. Only 20% of doctor practices or less actually have an electronic medical record. The company that I work, the company that my product at Intermed is called eClinicalWorks. They have 60,000 doctors as their customer base. If I can tap into a small percentage of that, or a decent percentage of that, I have a pretty good market to start with. So to bring Protocol RX to market, I've teamed up with WinXNet. WinXNet is a Portland-based network services and software development company. We've been working on this for just a couple of months. We did file a patent application already, and my beta contract was being reviewed today. I haven't heard back as to whether I have my first beta customer or not, but we hope to have them within the next week, and we can really hopefully deliver our beta product for them by the beginning of December. Thank you very much.